out that there are two main periods of the cardiac cycle. That's ventricular contraction, and that is where the ventricles are squeezing and they're essentially emptying. They're dumping blood either into the vessel that's leaving the left ventricle or the right ventricle. Then there's diastole, which is ventricular relaxation, and that's synonymous with ventricular filling. So this is where the ventricle is relaxing and blood is pouring from the atria down into the ventricle. The second important take-home point here is understanding that there must be a pressure gradient between chambers in order for blood to move, in order for those valves to open. So the opening of valves is not an active process. It's not requiring anything other than that pressure gradient. So they want to open passively when the pressure in the preceding chamber is greater than the pressure in the subsequent chamber. All right, so let's start with the first phase, which is ventricular filling. Now, as you mentioned earlier, the phases of the cardiac cycle are referencing the events that are taking place specifically in the ventricle. And so ventricular filling is that midpoint of diastole. This is where the heart has begun to fill. Again, a passive process as the AV valves are open. Right? You should remember the AV valves are separating the atria from the ventricle. And so the venous return, which is that blood that comes back to the atria, is now moving through the AV valve and into the ventricle. So as this happens, the pulmonary and aortic valves, which are the semilunar valves, are not open, they're closed, right? Again, because of that lack of the pressure gradient there. And the atria will begin to passively contract towards the end of diastole. So at the very end of this first phase, the atria start to contract just a little bit to squeeze that last bit of blood out into the ventricle. And this is ventricular filling. Now, anyone want to take a guess at what the volume will look like here? What do you think the volume is looking like during this phase in the ventricle? Is it decreasing or is it increasing during ventricular filling? It's increasing, right? So the ventricle is filling, and so we would expect the volume to be rising in this phase. That's correct. All right, phase 2, isovolumetric ventricular contraction. Now, during this phase, as the name implies, the volume is remaining the same. So what does that tell us? If the volume is remaining the same in the ventricle, what does that tell us about the position of the valves? They're closed. Perfect. So both valves are closed during isovolumetric ventricular contraction. And what's happening is this is the beginning of systole. This is where diastole has ended, that filling phase has ended, and we're starting to generate pressure in the chamber to eject that blood, which is the next phase. And so at the start of systole, both valves are closed, both the semilunar valves and the AV valves are closed, and pressure is gradually rising within the chamber. Now, what do we need to establish in order to open that semilunar valve? What did we talk about? What needs to be present for the opening of that semilunar valve?
Pressure gradient.
A pressure gradient, perfect. So we do not yet have that pressure gradient, right? Meaning that the pressure in the ventricle is not high enough, it's not greater than the vessel, and so the valve is not open yet. What's happening in this phase is the pressure is gradually rising until we get a pressure gradient. Until then, we don't have it. And so both valves are closed as that pressure rises. Okay. Phase 3, so this is ventricular ejection. And during this phase, the ventricle is emptying. So at this point, we now have a pressure gradient, meaning that the pressure in the ventricle is now greater than the pressure in that exiting vessel, either the aorta or the pulmonary artery. And so the valve passively opens and blood spills from the ventricle into that vessel. So what valves are open at this point? Semilunar valves. So that's the aortic or the pulmonary. So the semilunar valves are open here. And what happens is the pressure in the ventricle will start off pretty high. So as the blood leaves the chamber, the pressure starts off pretty high, right, with that established pressure gradient. But as blood leaves the chamber, that pressure gradually drops to where it's now less than the aortic pressure. Right, so I'll say that again. At the start of ventricular ejection, the pressure in the ventricle is pretty high. Right, you have a pressure gradient, so it's higher than the pressure in the arteries. But towards the end of ventricular ejection, as blood is leaving the chamber, the pressure eventually drops lower than the aortic pressure, and so we lose our pressure gradient. Because we lose our pressure gradient at this point, what do we think happens? We lose our pressure gradient, what happens at this point?
The B valves are closed?
Not the AB, the semilunar valves, right? So the semilunar valves would close because we have now lost the pressure gradient, simply because the pressure in the ventricle has dropped below the pressure in the aorta as blood leaves the ventricle. All right? That is the ventricular ejection phase. Finally, phase 4 is isovolumetric ventricular relaxation. This is a similar phase to phase 2, where both valves are closed once again. And this is the onset of diastole. So this is where we start the filling phase once again. So the ventricles are now starting to relax. Pressure is dropping within the ventricle, although both valves are closed at this point. So volume is not changing. And what we're trying to do is reestablish a pressure gradient to where the pressure in the ventricle is now lower than the pressure in the atria once again, so that we can start phase 1, which is the filling phase. Okay, so during isovolumetric ventricular relaxation, both valves are closed. There's no change in volume, so blood is neither entering or leaving the ventricle, and the pressure is gradually dropping so that it's now less than atrial pressure to reestablish phase 1, or the pressure gradient that's required for phase 1. Okay, any questions on the 4 phases? Alrighty, so this is how blood moves throughout the 4 chambers of the heart with every single heartbeat. Now, what we want to really understand at this point is that of these 4 phases, the heart spends the most time in phase 1 and phase 4. So this is corresponding with diastole. And the heart spends more time in this phase intentionally to increase the amount of time that it's filling. Right? The heart is not an efficient pump if it cannot fill effectively. So it spends significantly longer time. So the 0.1 seconds, that is a heartbeat, about 0.8 seconds, about 0.5 is spent in diastole and 0.3 is spent in systole. So it spends more time filling so that it can effectively pump that blood out. What we'll move on to talk about now is the pressures. Right? So we talked about the movement of blood that happens throughout each phase, but let's shift and let's look at how the pressure changes from one phase to the other. So let's look at the pressures in phase 1. Now, what period of the cycle did we say phase 1 corresponds to? Systole or diastole? Diastole, right? So phase 1 is the middle of diastole. We said the cycle starts out right in the middle of that filling phase. So what happens here, atrial pressure is slowly rising, right? You can see it reflected in this tracing. So at the start of atrial contraction, which is about midpoint of phase 1, we have the atria gently squeezing that last bit of blood out. Before that, this is a passive process. So the pressure in the atria is rising slowly as blood is leaving. And then there's a small rise in pressure towards the end of phase 1, again, because the atria is squeezing or attempting to squeeze that last bit of blood out before that valve closes. All right, and so that's the pressure in phase 1. Phase 2, right? So phase 2, what did we say that corresponded with? Or what did we call phase 2? Can anyone remember? What did we call phase 2 of the cardiac cycle? Correct. So the isovolumetric ventricular contraction, and that tells us exactly what's happening in phase 2. There's a rapid rise in ventricular pressure, and atrial pressure is going to drop at this point. Okay, the AV valve has closed, the atria is no longer contracting, and what happens now is pressure in the ventricle is rising to generate that pressure gradient that we spoke about. So in the tracing, we can see at the beginning of phase 2, we have a steep increase in ventricular pressure, right? So this green tracing here shows that steep rise during phase 2. And again, this is representing that rise in pressure during isovolumetric ventricular contraction. Phase 3, which is corresponding to the ejection phase. This is where blood is leaving the chamber. What do we expect to see the pressure look like for phase 3? It's going to be greater in the ventricles, correct, than in the vessel. That's our pressure gradient. But how is it going to change throughout phase 3? How do you think that the pressure is going to change throughout phase 3? Perfect. So it's going to start off high. So we already have that pressure gradient. So it starts off nice and high, right, during phase 3. And then towards the middle of that ventricular ejection phase, it's going to start dropping off quite gradually, quite rapidly, sorry. So it's going to drop right off, and that's going to continue to drop throughout phase 4, right, ventricular relaxation. And so this is how the pressure changes in the ventricle mainly, that's where we're going to focus, throughout the events of the cardiac cycle. It's going to start increasing during the isometric ventricular contraction. It's going to get to a peak at the middle of the ventricular ejection, and then it's going to slowly drop off towards the end of phase 3 and into phase 4. Okay. Any questions so far? Any questions? Okay, so let's continue on.
So the phase 4 method, that would just be like phase 1 again?
Phase 4 would be leading into phase 1. So phase 4 is that isovolumetric relaxation where both valves are closed, the pressure is just dropping, and when it gets low enough, we get back into phase 1. Everyone understand that? So phase 4 and 1 are diastole, phase 2 and 3 are systole.